Today we went to Health and Human Services. We stopped into their operations center and talk about the effort they're putting in to help contain and address the health issues related to the COVID-19 flu virus, sometimes called coronavirus. Secretary Azar came and spoke to us and talked about some of the things they're doing. Obviously there's a federal component to help work through this. There's also a lot of work being done by a lot of different states as well as local health departments. One of the things that we talked about was obviously we need to look at a twofold effort. Part is to contain it, part of it is to mitigate it. The containment is looking at how do we make sure that there's not major hotspots that pop up and work through that. Obviously the COVID-19 virus is a lot like other flus in terms of it's spread from human to human contact. So we need to be smart in terms of dealing with that. We need to, if you're sick, stay home, don't go to work, don't go to school. If you sneeze or cough, use a tissue or use a handkerchief and then throw the tissue away, and wash your hands and make sure we address that. The other things that are unique about this is it seems to be a little bit more communicable in terms of it spreads easier. However, it's in terms of the effect on individuals, there are about 80% of the people will have little to no symptoms dealing with it. The other 20% probably will need medical treatment. In some cases need to go to the hospital. And unfortunately, some people do succumb to the virus. One of the unique things about this is that it seems to be more of an impact on elderly individuals, folks that have a previous health issue, whether it's an immune deficiency, whether it's a pulmonary breathing issue or a cardiac issue. It doesn't seem to have as much impact on children that the normal flu virus does. So those are types of things to keep in mind as we go through this process. The other thing that we're trying to do when we look at the containment and the mitigation process is make sure that we're able to treat the individuals that are sick. And so making sure that we're addressing spikes and minimizing major flare-ups in terms of the number of people that are infected so that our health professionals, the doctors, the nurses, the EMTs can all do their job to make sure things happen. So again, this is one of those situations that it is an illness. It's a lot like the seasonal flu that comes through. You know, if we look back on the seasonal flu this year, since September, we've had roughly 30 million people affected with a seasonal flu, and approximately 25 to 30,000 people that have passed away from that. So we're nowhere near that issue with the COVID-19 flu virus, but we still need to practice our good hygiene. If you're sick, stay home, don't go to school, don't go to work. If you sneeze or cough, make sure you're using a tissue or a handkerchief, and make sure you wash your hands a lot. So that's the thing that we need to do to make sure that we all protect ourselves, our families, and our community.